Good evening. My name is Rodgena Lee. Tonight I will be doing my interactive assignment on home visiting. This is a program that falls under the Office of Planning, Research, and Evaluation. The acronym OPRE is used. This office falls under the Federal Department of Health and Human Services, also known as HHS. The Office of Planning, Research, and Evaluation is an organization that studies administration for children and family programs and the populations that they serve through very strict and meticulous assessment projects. The OPRE are very competitive in acquiring funds to run their office as they operate off of grants and contracts. The OPRE falls under HHS. They have the responsibility for advising the Assistant Secretary for Children and Families on increasing the effectiveness and the efficiency of the programs in order to improve the economic and social well-being of children and families. Their target population in the Home Visiting Evidence of Effectiveness program, otherwise known as HOMV, are pregnant women and young children birth to age 5. I think the developmental stage at this point is the transactional model, as Samaroff and Feast speaks on the mutual effects between parent and caregiver, regulated by cultural codes. However, the target audience would be researchers, policymakers, practitioners, and stakeholders at the national, state, and local levels that also make use of the OPRE. The geographical location is Washington, D.C. The Office of Planning, Research, and Evaluation also works in conjunction with the Administration for Children and Families. The U.S. Department of Health and Human Services, Administration for Children and Families in 2009 to 2018 states the Patient Protection and Affordable Care Act established a maternal, infant, and early childhood home visiting program that gives $1.5 billion over 5 years to states to establish home visiting programs for at-risk pregnant women and children from birth to 5 years of age. The Act stipulates that 75% of the funds must be used in programs with evidence of effectiveness based on strict evaluation research. Home visiting programs provide education and support to parents and their children to help meet their individual needs. They give referrals to outside community-based services. It's very important that the families understand how the referrals work and how vital they are as they help get them to providers in the community that can meet some of their needs. Things like referrals to mental health services, child care, and so much more. The OPRE also coordinates performance, management, as well as strategic planning, and they also provide guidance to these programs, analysis, and some oversight. Through their research, they have begun to see and understand the importance of helping low-income working parents balance work along with family obligations. The expected outcome of this program is to make improvements in the services offered for low-income families and to educate the children and their parents. The research for fiscal year 2016 and HHS and the government showed OPRE was responsible for $123 million in grants and contracts. Modifications that I would make. I would make sure all information was current. I would like to see more health-related information on pregnancy for moms. What kind of prenatal care are they getting? Maybe even starting a program to couple the moms and children with a nurse, case managers, group sessions with other parents-to-be. I would want to expound on the pregnancy itself. It is very important to know where to go and what to do for things such as depression, stress, no income, poor nutrition, and lack of health care. Ask questions such as, are they dealing with alcohol and drugs? Do they live in a safe neighborhood? I believe if more of the vital information was given to the pregnant moms and their family members, not only would it increase awareness to those harmful risk factors, it would build strength and empower them to make better decisions in terms of health and wellness, as well as help develop cognitive skills. There was a study done, and it was called the Healthy Eating and Lifestyle in Pregnancy group, and they call themselves HELP. So it was a feasibility study, and it showed up in the British Journal of Midwifery. This study was done to explore group-based weight management for pregnant women. There were 144 women that participated until they were 6 weeks postpartum, with a mean age of 35, a BMI of 37.4. The study found that the group that ate healthy in the HELP group proved to be a healthy intervention, which goes to show that programs like these are needed and should become community-based to educate pregnant women to healthier lifestyles. Thank you.